the ED, I think, is the best place to learn pediatrics here at Children's Hospital. It's a very busy ED. We see about 75,000 patients a year, and we're the only referral center and the only children's ED and level 1 trauma center in the region. As faculty in the ED start you very early off in teaching you the basics of procedural competency. One of the examples I can give is doing lumbar punctures. We have a just-in-time training, a simulation center within the emergency department. So when you're going to do a LP on an infant, we say, okay, let's go to the simulation center, let's practice, show me what you know, and we can go through any hiccups that you might have before we actually go perform a LP on a patient. It's really nice because you get to rotate through the emergency department every year, and we get to see you grow and develop as a pediatrician, and therefore you'll be taking care of sicker patients and you'll be given more autonomy, always knowing that you'll have faculty presence to back you up. It's also a place where you're the first person to talk to these families and these patients, and it's really nice in the emergency department because you go see a patient and you get one-on-one education feedback from the ED faculty in real time, and oftentimes go back into the room with the ED faculty member or fellow and go through the pertinent positives and negatives, and really as a team learn how to take care of these patients and develop management plans for patients in the emergency department. We will have the residents go through simulation-based courses throughout their residency, as early on as intern orientation. And one of the things we do in intern orientation is a course designed to be the first responder to an acutely ill patient on the floors in the hospital. And the goals are to, you have backup, you have more senior level people, but if you're the first person at the bedside, how do you take a brief assessment and start the resuscitation? The other thing that course, the rapid assessment and treatment of these acutely ill patients, is really getting familiar with how the rooms work here at Children's, how the monitors work, how the code works, who's going to respond to the code, who's going to be there to help you when you have an acutely ill patient. So that's one example of the simulation courses that we start very early on.
I love our emergency department at our hospital. There's several reasons. One, because you see a variety of things. You see the basic things such as an abnormal rash, to a very striking and sometimes saddening traumas that come in. And as a resident, really, we are the forefront of the emergency department. So we are the first person after the nurse takes the vitals to see the patient, to get the history, to do our exam, and it's really a chance in the hospital to be that patient's physician. You're the first person they see. And also our attendings and our fellows in the emergency department are the best teachers that I've ever met. They sit down with you, they explain things, they go back in the room, they show you physical exam findings that you may have missed. It's a lot to see, but it's really exciting.